Okay, so we had gone through this slide in the last week. There was some small change that I have made after going through some of the texts and some articles. So it is mainly in this food key part. So once the food, we take the food and to that spleen key adds its software, then that becomes food key, and along with that food key there is some byproducts, and that when food key comes, so there are two main ways that it gets re molded. So the food key gets added, the spleen key sends the food key to the lungs where it gets added with the pure air, and that gets converted to gathering key, and this gathering key gets added with the original key. When the liquid essence gets converted into energy form, that energy we call it as original key, and that original key gets added to that gathering key, and that takes the form of true key. Okay, and this has its own functions, like in controlling the lungs and heart, all of those things, this has a play. So next step is whatever is this true key gets added to the food key once again, and then different levels of software gets added. Along with that, if the lungs key gets added, it becomes defensive key, and to the same thing, if the heart key gets added, it becomes blood, and without anything added extra, this thing becomes nutritive key. So where we call it as body fluids. Body fluids have lot of different forms, say starting from mucus, milk, and CSF. There are so many different forms of body fluids. So it takes the body fluids and it is called as nutritive key. So this is the one of the change which I made compared to last week, which I wanted to update. Okay.
Good evening, Krishnamurthy.
Good
Can
evening,
you
ma'am.
please repeat this change? I just heard the word change since last time.
Uh-huh.
Maybe
You
this
want me to show the old one?
nutritive, yeah, nutritive key. What change is the one you've
Okay,
made?
I will give me a moment.
Thank you.
Okay. Okay. In the last session, I had put a question mark over here. When wherever there was nutritive key, I was not sure what it is happening. Okay. So I had put food key plus true key is equal to nutritive key, and I put a question mark. And then to this nutritive key, when the heart key gets added, I had thought it would become blood, but it is slightly different. Okay, so this is the correct form as of now. See, the more we study, the more we understand the dynamics over here change, or there will be some addition and modification. But as of now, with the current knowledge, this is the knowledge which is in the form of a flow chart. If you go through any of the books, it will be in the paragraph wise, and it will be quite difficult to kind of grasp what is happening where.
Yes, yes. Your diagram is very nice. It's very well explained. Thank you.
You're
Thank you.
welcome. So please make a note of this. And this was the last week's part. So this week, so we will. So initially we were going through different organs. Okay, and what are its functionalities as per TCM? That is what we were learning. In the first week, we learned about lungs, and then we saw that there is a need for understanding the key little bit more. And then we went through the deep dive into key, and now we are back to the organs. So this week we will try to learn about liver. Okay. So as per TCM, what does it do? There are some overlaps on what the Western medicine says and what TCM says. There are similarities and also um, there are differences. Okay, sorry, there was an interruption. Okay, so okay, the first thing, liver, as per TCM, it stores blood. Even in allopathy, they say that the liver stores blood. Liver is like a spongy kind of, made out of spongy kind of material. So if you know the sponge which is used to clean the surfaces, okay, it is very spongy. Lot of pores are there inside the sponge. As soon as you dip the sponge in a water, it kind of sucks in the water. Imagine for a moment, the liver is also something very similar. Okay, so through that sucking action, it keeps certain amount of blood which is there inside the body, approximately about 20%, let us say. Okay, like about 1.5 liters of, like in the whole body it is about 5 liters approximately the blood is there, and 1.5 liters worth is there in liver, that is storing that 1.5 liters worth of blood. So it is somewhere around 20 to 25% of the blood is in the liver. So the remaining 70, about 75% of the blood is circulating inside the body. So now what is it doing, keeping that 25% of the blood? So it has a lot of functions. So it will purify that blood, and that blood gets sent or nourishes in different parts. So we will try to understand that. So that is the first function that the liver does, that is liver stores the blood. Okay, and it is important to know this because lot of diagnosis will be made based on just this statement. Liver stores that blood. Okay, and second thing is liver monitors and flows the different directions of energy. So last time we had discussed one just, just a moment. So in last week we had discussed about this figure, okay, where what is happening, the liver is monitoring the entire flow of energy throughout the body, smooth flow of energy throughout the body, that is its primary direction. And secondary direction is, it is also rising the energy upwards. So liver has these two things. One is the direction of the entire key, the smooth flow in the whole of the body, that is its one of the primary responsibilities. Okay, so liver monitors the flow and direction of energy. Liver controls muscles. What does it mean? So it is very important to correlate the first thing and the second one. Say somebody is sitting, so the amount of blood needed in the muscles is less because they are doing some work or something, like, or you are just sitting and listening to the class. Now immediately there is an emergency and you will have to run out of the building, either because of an earthquake or fire or something. You will have to move. So what is needed to move? Your muscles will have to function. And for the muscles to function, it requires extra blood. Where is that extra blood coming from? The liver will supply that extra blood to the muscles. and that is how the muscles will move and you will be able to run or do any of the activities based on the muscles. So the TCM says liver controls muscles. Okay, so this is the link. Okay, because it provides the blood to the muscles, that is how it controls the muscles. Okay, and how does it supply the blood to the muscles? Because it stores the blood, that is why it is able to supply the blood to the muscles. So if there is any problem in the muscles, where should our first attention go? The attention should go to the liver. What should I do with the liver, or how is liver responsible for the muscles, tendons, etc. And the liver opens in eyes. Okay, we will discuss this in detail little further, but as per TCM, it is telling that the liver opens in eye. What does it mean? Say stomach opens in mouth, means something we eat goes from mouth to the stomach, and the lungs opens through nose, means something which I breathe goes into the lungs like an opening. Now the same logic if I try to apply here, liver opens in eye, it makes no sense on like how is eye related to liver, the same way which the mouth is related to stomach and nose is related to lungs. How is the eyes related to the liver? We will try to understand that. And next, in TCM table, the 5 element table, it says that the nail is a flower of the liver. What does it mean? Say when I see a flower, I can understand the health of the plant. So in the same way, in the body, liver is inside. I can't see the organ itself, but something else is outside. And if I see that what is outside, I'll be able to make a fair judgment on how the liver is functioning. And what is that flower which is outside the body? That is the nails. When I see the nails of a person, I can make some educated guess on how that person's liver is functioning. Okay, so that is where we say that the liver reflects in the nails. And the last one is ethereal soul resides in liver. So when we were discussing about the lungs, we told that the corporeal soul, as per TCM, there are two souls in the human body. One is the corporeal soul and the other one is the ethereal soul. Corporeal soul is the worldly matter, the worldly thing. When the baby is born, like when the baby is in the womb, it is not breathing on itself. Okay, it is breathing with the oxygen which the mother takes. But when the baby comes out of the womb, they cut the umbilical cord and generally they keep the baby upside down and tap on the lungs area. So the baby takes the first breath. Okay, so it means that that baby gets connected to the world, the corporeal world, and the baby's body gets connected through the breath. Okay, and the breathing starts. It means that the corporeal soul or the worldly soul entered the body, and that is why they say the corporeal soul stays in the lungs. Okay, and that is the worldly desires or worldly kind of activity, and this is an ethereal soul. Ethereal soul is more like a divine kind of thing, and the TCM says it resides in liver. Okay, so how is that? What all those things, we will go step by step. So we will take into the blood part. Okay, so the liver stores the blood, and I discussed about this. Whenever there is activity, more blood is required, so the liver provides that extra blood which it had stored itself. Okay, and when the person is in rest, so that liver sucks in some more extra blood which is not needed in the body at that point of time. And while the blood is there in the liver, what does it do? It does lot of functions. Like we keep hearing that it has more than 500 functions that it performs, and more than 1000 chemicals it gets released. It is also called the uh, like, it keeps on releasing lot of chemical factory of the body, it is called. So the purification part of blood happens while the blood is stored in the liver. Okay, so when we eat the food goes through stomach and the small intestine absorbs the juices. So when it absorbs, before it gets converted to the blood, when it absorbs, it is not in the blood form, right? So what happens, that unfinished blood, okay, unfinished blood will go into the liver, and the liver processes it and then sends that blood to the whole body, so that juices gets converted into blood. Okay, so and any kind of toxins which has to be broken, etc., all those things is done by liver. And because the liver is also storing that blood, okay, in female, okay, in during their periods, the blood comes out. Okay, and what TCM says is the blood which is coming out of the female genitals is directly linked to the liver which is stored in the, sorry, the blood which is stored in the liver. Okay, so I'll show this figure. So the blood which comes out of the uterus is coming directly from the liver. Okay, so it is a very important. Okay, I have 10 more minutes. So once the meeting ends, so we will rejoin with the same user ID and password without any break. So it is very important for us to understand this liver is a storehouse of blood, and that blood gets released into the uterus, and that is how the periods happen, the menstrual flow comes. If the menstrual flow is not coming, it means what? It means that there is not enough blood inside the, say imagine a tap. If you open the tap, the water should come. If the water is not coming, it means that the tank doesn't have water, right? If the tank doesn't have water, two things can be possible. Outside, the municipality is supplying the water, but it is not getting stored in the tank, or the municipality itself is not supplying the water, and also there is no water in the tank. These are the two possibilities. That is why when I open the tap, the blood is not, the water is not coming. So why I am giving this analogy is because when, say imagine this is the tap, the blood should flow out of this. If it is not flowing, it means that the tank which is holding the blood is not having the blood. If it is not having the blood, there could be two reasons. One is there is less blood in the body itself. Second, there is enough blood in the body, but not enough blood is getting stored in the liver. So now the treatment will be different. Okay, so when there is no blood coming in the during the periods, I treat liver blood deficiency. I'm just giving, these are some advanced things, just because it is making sense in this topic, I'm trying to say. If you are not able to grasp it, nothing to worry. So I try to push more blood inside the liver. When I give liver blood deficiency, the liver's blood ability to absorb more blood will happen, and more blood gets into the liver. But if the blood itself in the body itself is low, then the only liver blood deficiency will not be sufficient. So I will have to increase the blood in the entire body. How do I do that? So if we see the previous slide which I had shown. Okay, so here what is blood? If the entire body itself is having low blood, then what do I have to do? Heart key plus food key. For food key means what? Food plus spleen key plus heart key. Means if the blood is less, I will have to increase the heart key, because as per TCM, the blood is created in the heart. Okay, so I will have to increase the heart key by giving the heart key points, and also I will have to increase the spleen key by giving the spleen key points. These are the softwares. But what is the hardware? I should give proper nutritious food to the body. So these three important things is supposed to be done: food, spleen key, and heart key. And if there is any problem in this true key, so then I will look into the kidney essence or the kidney part. Okay, makes sense? When there is no low blood in the body, my first attention should go to proper diet, spleen key, and heart key. And even after that, the blood is not increasing, then I look into the kidney. Okay, I hope this part is clear. So I come back to the uterus. So in TCM, uterus is not considered as an organ. Liver is considered as an organ, because uterus is a auxiliary organ of the liver. Okay, so uterus is an auxiliary organ or a secondary organ, you can say, of the liver. So by taking care of the liver, I am indirectly treating the uterus. So that is why in TCM there is no separate mention of uterus, okay, as an organ. So I was telling that the liver stores blood, and it is a very important thing in menstruation. So if there is excess menstrual fluid, like excess of bleeding happening, what does it mean? That the blood over here is excess. What does it mean? Either there is lot of heat in that blood, and that is why it is trying to go out. Okay, so if there is too much of heat in the body tries to throw it out. Okay, so that is why one of the reason could be that if there is excess of uh, bleeding happening in the periods, one of the reason could be that there is excess heat in the liver. Okay, so if you understand this relationship between the uterus and liver, lot of diagnosis you will be able to do. Okay, and the liver opens in eyes. Okay, it is let me see if there is okay, I'll come to this little later, so I'll go over here. So there are 3 minutes left. So ethereal soul, these parts I have discussed. Okay, liver opens in the eye, liver reflects in the nail. If by seeing the nail I can kind of make a fair judgment about the liver, and the ethereal soul resides in the liver. Okay, and when there is okay, now the liver monitors the flow and direction of the energy. So the entire energy flow in the body is monitored by liver. Liver is like a class monitor, you can imagine. Okay, Now, where all does the direction come into play? So now, in the flow of the bile, okay, if there is a problem in the liver, the bile doesn't flow properly, okay, and that causes bitter taste in mouth, belching, etc., etc. Okay. Second, here it is a metaphysical to the physical relationship. Okay, when there is my ethereal soul, okay, like you should understand there is a link between that ethereal soul and the emotions. Okay, now when the mind gets stuck in some thought, the energy flow in the body also gets stuck. Okay, because it is an ethereal soul, which is soul has thinking ability, okay, as per TCM. Okay, we are not going into different directions. Okay, it is less than a minute. If it breaks, if the call gets ended, we will rejoin using the same user ID password or the link. Okay, so like, because it is very important for diagnosis, listen to this with lot of attention.
Yeah, still
Okay,
I tried
so
actually.
somebody is okay, please mute yourself. Radhamani. Okay. Okay. The mind is thinking, it is moving, and that mind's movement is also making the key inside the body, the energy inside the body also to move. And if the mind gets stuck because of some tension or some worry or anxiety or anything, it influences the direction of flow in the body. That also gets stuck. And our classic treatment at this point of time is liver key stagnation. Okay, it is so vastly used especially in the present. Okay, so I will start the session. Now I was telling about the emotions part, especially in the present scenario where everybody is kind of stressed out in some form or the other worries. Okay, either it could be a problem with relationship or problem with the finance, problem at work, or something or the other. Whenever there is a problem, and if the mind is stuck, the energy flow gets also stuck. At that point of time, to make the energy flow once again, we give the treatment is liver key stagnation. So if the key stagnates for long time, it is an invisible energy which is stuck. Over a period of time, even the visible energy, which is the blood in the liver, also gets stuck. Okay. So it is a very important thing to understand. The uh, key, the invisible energy gets stuck, and over a period of time, the visible energy, which is the blood, also gets stuck in the liver, because the liver processes and holds the blood. Okay. So at that point of time, we treat the liver key stagnation and also the liver blood stasis. Okay. So this is about the emotions. And now the liver also actively participates in the digestion process. Okay. The spleen and stomach is the one which is directly doing the digestion process, but the liver helps these two things. Now, you will hear a lot of protocols in TCM which uses this word attack. Okay, that is why I have put as attack business. I couldn't comprehend what this attack means initially. So, liver attacking on small intestine, liver attacking on spleen, liver attacking on stomach. So many protocols you will hear, and it is important to understand what it means. See, it is just like a balancing act. Like you see a tug of war where two parties are pulling each other. And if the pulling force of these two parties are in balance, the rope will be in one place. And if one party becomes loose, the strength reduces, then the other party will take over the uh, the rope on their side. Something very similar is happening over here also. Every organ has its own energy and it is in balance with the other organ. And we have heard that liver is never deficient. It can be in normal functioning or it can be excess. It will never be deficient. That is what we have heard in TCM. Okay. Now this liver is um, hyper, let us say, and any one of the other organ, spleen or stomach, is deficient. Okay, like the spleen is deficient, what happens? The energy balance will get imbalance. The liver will have more energy over the spleen, and spleen will not be able to compensate for that, that energy tug of war which is happening between these two organs, the liver and spleen. So because spleen is weak, there is more influence of liver on the spleen, because liver's energy is flowing in all direction. Now in this scenario, when the liver's energy is more than the organ, we call it as an attack. Liver is attacking spleen, liver is attacking small intestine, liver is attacking stomach. So each of these scenarios will give different symptoms. Okay, so based on the symptoms we can understand what is happening between these two organs, the liver and the other organs, spleen, stomach, small intestine, etc. So how is this attacking happening? It is basically the liver is putting more power on that particular organ, and that organ is not able to perform its own function properly, because there is a too much of external pressure from liver. Okay, so this is the attacking business. So we understood this. Now liver controls muscles. Okay, I discussed about this in the beginning itself. So if I want to make the muscles function more, move, like run, etc., etc., lift some heavy weight, so the muscles requires extra blood for it to do. So what happens? The liver provides that extra blood into the system, and it will have lesser blood for its processing. Okay, and this is also very important to understand on these kind of symptoms. When it is very important for you to please pay attention. If there is a cup or glass, and if it has half water, the half will be filled with air, right? So similarly, the liver is a spongy kind of organ. If there is less blood in that sponge, so imagine half of the liver is filled with the blood, and the other half is filled with what? In this scenario, it will be filled with air. Now because it is a kind of a spongy organ, if it is tries to, and it is connected to the portal vein, so the portal vein, if it is not giving enough nutrition or blood in the portal vein, and if it tries to suck, the liver is spongy, so it tries to suck the blood from the portal vein. what happens? There is nothing for it to suck, only air is there. Now, because only the air gets pulled, the tube, like if you would have if you would have seen any, um, say, tender coconut, if you're drinking tender coconut with a straw, when there is water, water is coming. But when the water gets emptied, what happens when you further suck it? Only the air comes. You should observe that when only the air is coming, the straw gets twisted because of the air pressure. There is nothing to flow inside. Okay, only the air is pulled, and because of that there is a twist in the straw. Something very similar is happening. There is no blood to be sucked from the portal vein. So what happens? The similar twist happens, and that is what causes the cramps. The liver is sitting, and the second reason is you are just sitting somewhere. Okay, the liver is processing the blood because it is not needed, and now you suddenly try to start walking. The liver does not have enough blood to supply back to the muscles. That is why the cramp happens. Okay, the muscle doesn't have enough blood for it to function in the way that it is intended to. That is why the cramps happen, because there is not enough blood to be supplied to the muscles. From where? From the liver. So liver blood deficiency. Now this other part which has only air, half blood half air, what does it do? Air does it's moving. So unnecessary movement of the, say, eyelids. I just, please give me a moment. Sorry for the interruption. See this, half of the air which is just filled in the liver. What is the nature of the air? It keeps on moving. That is the nature of the air. Now there is excess of movement which we can see in the body. The eyelids are like sluttering, and the eyes is kind of there are involuntary movement of eyeball or any squint eye. Okay, the one side the direction of the eye is somewhere, and on other side it is somewhere else, and the person is moving some body part unnecessarily. They are shaking. Some people, you can see that they unnecessarily shake the leg, and somebody shakes the hand, or there is the head keeps on shaking. All of this indicates that there is excess of wind inside the body. And which is the organ which is responsible for the wind as per TCM? It is the liver. Okay, so that the extra wind which is getting stored in the liver is causing all these problems, the unnecessary movement of something in the body. Okay, the tremors. So it is so whenever you see there is some kind of tremor in the body, and a very extreme case of that wind is called as paralysis. One side of the body, last time I discussed, the liver is on the right side. When the liver's wind rises, it affects the right side brain, and the right side brain controls the left side of the body. So if there is a left side paralysis, it means it is because of the liver's wind. It has become excess. So there are specific points to reduce the wind of the liver, and also we will have to provide enough, apart from removing the excess wind. So Like if I remove the wind in the glass, what happens? It will come back unless I pour the water, right? If I pour the water, the wind will get automatically removed from the glass. If I don't do it, only try to remove the wind, after some time it will once again get filled up. So in those treatments which is needed, it is advanced. So even those who are new, please just listen to it. When you get to study these things, it will help you. So I treat to remove the wind. Then I try to fill more blood into the liver, either by treating liver blood deficiency or the total blood deficiency, or if there is blood is related to yin. So if there is any yin part of the liver which needs to be treated, I treat that. So in this way, I take care of the liver. I hope this is clear. Okay. So next, liver opens into the eyes. Okay. If there is any problem in the eye, okay, as I told, the squint eye, one eyeball is moved. Okay. I don't know how allopathy people treat. Okay. So in TCM, we try to balance the wind. Okay. So in the eye, there is not enough, say one eyeball has, say, let's imagine like it has moved like this. It is because there is not enough muscular strength to hold the eye like this. So it has become weak, so it has moved. So once again, the muscles are controlled by liver. So I have to treat the liver. Eyes are also controlled by liver. So I have to treat liver. And what could be the problem? We will have to diagnose. Either the key, the blood is less or wind is more, which depending on what is the problem, we will have to diagnose. If there is any problem with the eyes, the first attention should go to the liver. If there is a low blood in the liver, so it will cause like dry eyes, some floaters or color blindness, etc. All those eye treatments come under liver. But in case if there is excess heat in the liver, there can be some, once again, it can cause dry eyes, bloodshot, like red color eye, and pain, burning, etc. And if there is excess wind in the liver, as I told earlier, squint eye, pupil misalignment, involuntary movement of the pupils, etc. All those things happen. And this is very important, this part, eye open and close mechanism. We said that the eye is the opening of liver. Just like nose is the opening for lungs, mouth is the opening for stomach. Similarly, so it's very crucial for you to understand this. Say, when I say opening, the food is going through the mouth into the stomach. Okay, the opening of the stomach is mouth. Through the mouth, the food goes inside the stomach. Similarly, lungs is there and its opening is nose. So the air flows through the nose into the lungs, right? Something is moving into the organ. So similarly, if there is livers, eye is the opening of the liver. So what goes into the liver through eyes, it is the light. What goes into the eyes? It is the light. The perception power comes through the eyes. So now it is a fantastic mechanism. When the light is going through the eyes, the liver performs one type of action. When the light is not flowing through the eyes, the liver performs another action. It has 500 different functions that it has to do, right? So when, okay, Dr. Narayanappa, you will have to mute yourself. Okay, when somebody is not no speaking, please mute yourself. It is no, basic things. Okay. I was telling that when the light enters through the eyes, the liver performs one type of function. And when the light doesn't enter through the eyes, the liver performs other type of function. Okay. So that is why we say that we should have a good sleep. So when we are sleeping, we close the eyes. So the light is not entering the eyes. Okay. So the liver understands now it is a different work that it has to do. The light is not entering. So when I open the eyes, say I blink, right? So for a moment, when I blink, the light entering the eyes stops. So now the liver gets an opportunity to do some function, and the eye opens, the light enters. So it shifts back to another function. So a proper rest is needed for the health of the liver. If our sleep pattern is uh, out of sync, then it will impact the liver. What is the timing of the liver as per TCM? Those who know, it is 1 a.m. to 3 a.m. So that is the time when we require deep sleep in the night. And when we sleep deeply, the liver will get an opportunity to do its some functions like purifying the blood, etc., etc. Okay. So that is why eyes is the opening of the liver. Okay, I hope you all have understood. And another thing that I told, liver reflects in nail. If there is any problem in the nail, people's nail is brittle, it tells that the liver blood is deficient. So that is why it is not able to nourish the um, nails. And in some places it is not black and uh, flaky or brittle. It is the shape is all kind of not smooth. Then we think, okay, the key in the liver is not sufficient. Okay, it is liver key stagnation. We treat liver key stagnation. So in that way, by seeing the nails, we can do some amount of diagnosis of the patient. Okay, so that is why the liver, the nails is the flowering part of the liver. So through nails, liver expresses itself. Okay, that is the flowering. And the ethereal soul resides in the liver, we told. So ethereal soul is more of a spiritual kind of being which gets stored in the liver. And if there is not enough blood in the liver, what happens? There is a restlessness which gets created in the uh, ethereal soul. Okay, and the ethereal soul becomes weak. And when there is no sufficient blood, okay, the blood in the liver is the one which nourishes the ethereal soul. And when the blood is less, it cannot nourish the ethereal soul. So it becomes restless. So then the thought becomes, it moves randomly, and proper planning cannot be done. Okay, the person is not able to lead a meaningful planned life. Okay, because the ethereal soul is getting disturbed, because there is not enough blood in the liver. So when we see these kind of patients who are very restless, who their planning is not right, you can make out, and they unnecessarily think, no, directionless thinking. So we treat the liver. Okay. Only thought is related to the spleen, but the direction to the thought is related to the liver. So we will treat the liver in those kind of scenario. So this is the chart. We will look into this little later. Okay, so now there's an opportunity for you to ask any of your questions.
Hello.
Yes, Manjuna.
Hello.
Yes, ma'am.
Sir, cataract eye will be the effect of the liver?
Cataract, I am not very sure, so I will not comment on it. So see, diagnosis is a very vast subject. There would be definitely some role. Okay, see, this is how you will have to understand. I will give you.
Yes, yes. Mm,
Eyes is
mm,
mainly controlled by liver, but
yes.
not entirely controlled by liver. So this is the catch.
Mm,
Eyes is mainly controlled by liver, not entirely. So what is that other things which control the eyes? All the other organs. Say, let's say 60% of the eyes is controlled by liver. The remaining
mm,
40 is controlled by the other organs also. Spleen,
mm,
it could be
mm,
heart, it could be something
mm.
else. So depending
Okay.
on the malfunctioning of the other organs, the
Mm.
diseases in the eye can also show up. So
Sure. Thank
specific to cataract, we will have to
Yeah,
see.
Okay, thank you.
but I like to add,
Mm.
Krishnamurti, this is Dr. Sushila Kamath.
Yes, ma'am.
Listening to all you guys, I'm wondering why I'm teaching PhD.
Why?
Because all my basic concepts have completely flown out of the thing, and it is so disturbing for me. But there, like you are going to such extents to try and connect, so we remember, like a mnemonic is used to remember certain words or certain way of remembering things. But I think it will ill behove us to take it beyond a particular point to think that, like you said, it opens in the eye. When you have jaundice, liver failure starts, when it's not first symptom is jaundice, which appears in your eye. And it
Mhm.
also
Yes, yes.
opens in your mouth. So you can see the yellow color in the eye, like flowering
Yes.
or flowering of your nails. You're
Yes.
reflecting the function of, actually, in our science, it is called koilonychia. Koilo means improperly formed nails. It happens when a patient has anemia due to any cause, or even sometimes lead poisoning. So, see, if I were to go by this diagnosis, I think I'll go berserk. So I'm having to relearn everything. And ours is an evidence-based science. It's structured. It shows you, yes, now show me this thing. This is all, 2,000 years or 3,000 years ago when they started Chinese medicine. It started with trying to understand, because they didn't have diagnostic medicine at all. So they tried to intuit, or they tried to think, they tried to rationalize, like our Krishnamurti sir is trying to do, and try find some reasons. And they found things which worked. First, it was empirical. Empirical means they thought, they tried and they got some result, and then accordingly they built up a sort of a system around it. That is a treatment system. But for me, I won't buy anything. Like you said, for the eye, for instance, Dr. Wohl says there are individual points around there where you have he has described a total different meridians around the eye and the orbit. So I think it makes sense to just to follow what he's saying. At least correct me if I'm wrong, Krishnamurti. Why I'm saying is, don't get carried away. I'm trying to teach BHB to all the semesters, trying to tell them how normal body functions. It is how normal body functions, how it is related, how did they try to intuit all these things, is what I'm trying to find out. But it doesn't mean that whatever he says, I can give you 100%, experimental proof of everything that we say. So I don't think there is an experimental proof. So what he says, we have to think in terms of how he's trying to teach us, trying to put how the Chinese people thought. I think that's what I mean. That's the sense I'm getting, Krishnamurti.
Yes.
Sorry if I said something out of place.
No, it is like.
I'm totally psyched out, believe me.
Okay. So, see, there are many things, as I told, the logic in which the human body functions is very mysterious.
No, it's not mysterious. 1 minute. It's
uh,
not mysterious. It is perfectly, it's beautifully structured. It's absolute an engineering marvel, believe me.
yes, yes, yes,
Every system works beautifully with the other. It's just that we are ruining our own health by what we have, we don't know. So if
yes,
you
yes.
really know what your health is all about, I mean, forget about health. I'm talking about the functions of each organ. How intimately, you talked about the portal vein.
Mhm.
Portal vein, portal vein actually carries the digested blood to the liver. From there, it gets taken back again to the inferior vena cava, back to the heart, to be pumped all over. The altered blood. What is required, the liver absorbs, and what is not required, it pushes back. It alters things for absorption. That is not only enough. Along with that, you have the lymphatic duct.
Mhm.
So, say lymphatic duct is not just only screening; it also aids in absorption of fats and large molecules. These are all solid science based.
Yes.
So I am a little psyched out. But
Like
if
probably once.
if really I feel if I
Uh-huh.
know my medicine or rather my anatomy and physiology, what I would advise, I mean, all the therapists who are here with us, it's wonderful. You're taking so much of pains to try and get it through to us. I'm learning many new things also about Chinese medicine. Apart from that, I'm trying to sync it with what I already know. And the armamentarium of investigations by finding out, coming to the root cause of diagnosis, by blood tests or whatever investigation methods, which are absolutely spot on. You have to prove it again and again and again. If you have a mass in the lung, you have to show it on an X-ray, or you have to show some, a functional aberration. Otherwise, they can't just say that, oh, he's got like this, he's got like that, he has some, because symptoms are again, though much as I mean, disagree, symptoms tell you something is wrong.
Mhm.
But one disease, I mean, one symptom can have 10 causes. This is what
Yes.
we believe.
Mhm. Yes.
Yeah, all of us all know that one symptom can have 10 causes. So if we keep on saying, look at the symptom, don't look at the cause, then where is the root cause?
So
So
we
root cause you
definitely
have to
have to look
arrive
into
at.
the root cause.
Yeah, I'm trying to find out how they well, let us say, come to a diagnosis based upon a rational way of thinking, a
Yes.
rational approach. That's
Sure.
what I'm trying to find. And I have seen things working. So for instance, I just blindly follow a protocol. It works. That's the thing when I get even more psyched out
Mhm.
because I cannot
So,
explain it.
so, but we
See,
cannot continue
so
in that way if we have to reach the global level.
yes, you have to make it a science. Even now, TCM is called pseudoscience.
Yes.
I object to that very much. It's not science because you cannot prove any evidence. We want to prove
So
that like you
probably
put
when
the
when
protocol,
we
you
figure
put
out.
the protocol, you bring the changes, and you are tell them we did not do a single thing except put this magnet and see the blood changes have taken place.
Mhm.
That's what I want to is my aim to bring it and show in
It is
what percentage it
it is
works, in what
perfectly right,
percentage.
madam. What the way that you are
Right or
thinking
wrong
is
is
the way
not
that
that.
we
It's
should
just
think.
yeah. So all the rookies who are here, all the youngsters who are joining for the first time, don't get too bowled over. Krishnamurti is a very brilliant speaker. He's a very logical, wonderful, intuitive person who can tell you a lot of similarities. These similarities are told to you to keep in mind certain things and remember. So when you know liver blood deficiency can lead to menstrual problems. Now I have understood how they said. Their science said that liver holds blood, so therefore, if there is any thing, you will have less menses, or rather, less menses are an indication of liver blood deficiency. I buy that.
Yes.
I buy that because it was a thing. But to say that yes, this is the cause, and okay, they didn't consider the uterus a very important organ, fine, but it doesn't matter. But the reasoning and the other things have to be a little more scientific. So that's why I said each of you must learn. So if you have put points for and again and again and again, I keep telling people, even in allopathic science, it's not one organ. It is not just dysfunction of thyroid alone. You have the hypothalamo-hypophyseal axis. See, all the organs who are in sync. If there is a disturbance of the mental level, we're talking here about you talked about liver and the mind. Very true. Yeah, these things are important. Okay, thank you so much for your time. I think
So
we
we
moved
have
on.
about
And
8 minutes, and
I
today we
have
have
a
reached.
question.
I will
I
take
have a
the question
question.
little later, Ritu madam. Today we
Okay,
have
all right.
reached a minor milestone in the books to brain series. So this is our 10th session. Like say about 20% of the class, the whole series is completed. So like out of 52, 10 is like 20% approximately. So I wanted to do a fact check about how things are going. Okay, in this because of this first milestone that we have crossed, I want to get some feedback on is these things helping or anything else needs to be improved in these series or any of your ideas. Okay, So I want to get some ideas from new ones who have not spoken. Okay. Like there are few international students here. I want to get their feedback, and some of them are brand new who have joined. Say YN Murthy sir, and there was one more other lady. I don't remember the name. So I want to see how much you guys are understanding, or is it just going above the head?
Yes, hi, dear Krishna. This is Abdulaziz from Kuwait.
Yes, Abdul.
Yeah, I think what the presentation or the classes that you are giving is very helpful for me. Learning small, accurate info where it's not even sometime written or I haven't read it till now. For me, the classes are too positive, and the knowledge that you are presented is honestly it's amazing. Maybe I have a lack of information. I'm still in beginning, but I believe it's fantastic.
Thank you. Thank you.
I'm with you guys.
Thank you. Even we are also learning. So
Yeah, thank you all.
thank you. Anybody else?
Hey, hi, Krishnamurthy. This is Parimala.
Yes, madam.
So this is my first class, and everything is going above my head. I mean, at least I can know the concept now. I can understand what is the function of the liver, what liver is doing. So the points is later on, but now I'm slowly getting what it is. So in the next class, most probably I can understand more things.
Yes.
So right now it is like not even I haven't completed A also in this.
Yeah, this is
So,
your first class. So even if you understand 5% of what was taught,
yes,
it is a very big
yes,
achievement. That much
yes,
you
yes.
were able to grasp, 5%?
Yes. I understood today's class. What is exactly the, I mean, what the functions? The function I have understood. So what is the where and all it is like the liver is connected, which part, each and every organs, how it is like affecting. If it is like the blood supply is less, so which and all the organs is getting affected. Yeah, I did.
Great. So
Okay.
you have your first class is success. So
Yes.
thank you.
Hope so. It moves on. Great.
Yes.
Thanks so much.
Welcome.
Thank you.
So anybody else would like to share anything? How has it been? How has been the journey? Anything to improve, add on to this journey? There was one more lady who has, Shanti madam has raised her hand.
Hi.
Yes, madam.
Hi, this is Shanti here. Can you hear me?
Yes, ma'am, I can hear you.
Yeah.
I
The
can
classes are actually very good.
Mm-hmm.
Yeah, the classes are very good, no doubt.
Mm-hmm.
And because of the classes, we are continuously in reading process. That is the truth.
Okay, great.
So the topics which you give, we also go through, we also glance before the class, and after you end the class, we get some new ideas. So we think in that point of view also. So it's truly helpful because we are continuously in touch with the subject. Otherwise, we won't open the books.
Okay, nice.
Unless and until we get the patients, we don't. As it is pandemic time, we treat very less number of patients.
Yes.
So in that way also, it is helping and revising whatever we studied. That is also happening.
Very good. So
and along with the Sushila Kamath ma'am, I also agree. It's a beautiful science, and even though proof is not there, that is going for crores and crores of investment to prove this science. It is better to use the science. That is my policy. Because just by to say it in single word, this acupressure, along with this naturopathic way of living or the classical acupuncture, that is, if you follow
I'm
this.
Sorry, there is just less than a minute.
Yeah.
So After
Yeah, yeah,
10
understood,
minutes,
understood.
after
Yeah,
10
we will
minutes,
catch up
we will
later.
have the revision of the previous class. So those who are interested can join. Because I was not able to record, I am redoing it. And there will be a 10 minutes break. And those who are seeing this on YouTube, etc., if you are interested to join this classes, so it is just 1,000 rupees for an entire year. So please contact me on my number, which is shown on the screen. And the classes have started from Feb 12th. And the timing is Thursday, not on Fridays. It is Thursday, 6:30 p.m. to 7:30 p.m. IST. Okay, so I think it is about to end. I hope at least some of you would join, those who missed last class, and we will go through those classes now, going after 10 minutes. Okay, thank you.
Krishnamurthy sir, 1 minute.
Yes, sir. Yes, sir.
Sir, Krishnamurthy sir, 1 minute.
Yes, sir.
Hello, Vajan Murthy, yeah?
Yes, sir.
Now, as we said, right, I am a basic